Many Americans take pills every day to manage disease and improve their health. For the heart rhythm disorder, atrial fibrillation or AFib, blood thinners that help prevent stroke-causing blood clots can make minor injuries life-threatening. So for patients like one of our guests, an avid traveler, the risk of being hours from medical attention can be dangerous. Jim Burroughs is a documentary filmmaker, joined by his cardiologist, Dr. Shephal Doshi of Providence St. John's Health Center. Good morning.
Good morning.
Doctor, what is AFib and how is it typically treated?
So atrial fibrillation is an electrical disorder of the heart. When most people think of heart disease, they think of a blocked artery causing a heart attack, but this is very, very different. AFib affects nearly 5 million people in the United States, and the incidence is nearly 1 in 10 for patients over the age of 70. What happens in AFib is that the heart starts beating irregularly because it's having a short circuit, and that causes a blood clot to form in the heart, and this blood clot can get dislodged and go to the brain and cause a stroke. So patients who have AFib are nearly 5 or 7 times increased risk of stroke compared to the general population. And so for nearly 50 years, the only therapy we've had for these patients are blood thinners, which prevent the blood from clotting as much, so it reduces the risk of blood clots forming in the heart. The challenge is that nearly 30 to 40% of the patients in this country who have atrial fibrillation are either struggling with blood thinners because they are bleeding, or they have some interaction with their medicines that they can't take it well, or they're not even prescribed a blood thinner because they're falling all the time or they're unsteady and people are worried about them having a bleed. So there's a huge unmet need for new technology, a new strategy for these patients who can't take the life-saving blood thinners.
Jim, what led to your diagnosis and would you describe your initial treatment path?
Yeah, I was on a film shoot out of the country and I was taking a day off and I was going to jog. And I did jog for a while, but it was so darn hot that I stopped. And when I did stop, I suddenly felt really dizzy and palpitations in my heart and a weakness that was extraordinary. It was scary. And I went to the nearest emergency room and they told me I had atrial fibrillation, which is something my father had. And they put me on blood thinners to make sure that I wouldn't have a stroke so I could continue my work. Well, my father had been on blood thinners for quite some time as well. So I had a little clue as to what I was in for. What I was in for was the fact that with taking blood thinners, there was no way I was going to be able to travel to the places that I make films, such as New Guinea or Central Africa, Afghanistan, covering the wars. It would be absolutely impossible unless I found another option.
Doctor, medical advancements are affecting AFib patients and the way they manage their condition. How so?
So, you know, it's been over a decade of research where we've been looking for alternative strategies, and Jim was one of the first patients in the United States involved in a clinical trial where we implanted this device called the Watchman, which is a small device which is implanted into the heart without surgery, no open heart, but done through a small wire inserted through a vein. And the procedure takes about 30 or 45 minutes, and what this device does is that it blocks off the area where most of the blood clots come from. And so it was studied as an alternative to taking blood thinners, and what we found is that not only does it reduce the risk of stroke like blood thinners do, but it prevents the complications that we typically see with blood thinners, such as hemorrhaging or bleeding, and in some studies it even improves survival. So, you know, in March of 2015, the FDA approved this for use in the United States and is now commercially available for patients who need to be on some sort of strategy to reduce their risk of stroke who are not good candidates for long-term blood thinners. This is an alternative for these patients.
Jim, how have your life and your career been impacted by the Watchman device?
Well, I'll tell you, it was about a year before I got to Dr. Doshi, and he implanted the Watchman device, which is made by Boston Scientific, with whom we're partnering here today. And I guess the bottom line is that the Watchman was a lifesaver for me and a career saver. And it's the experience I've had with the Watchman, which has enabled me to climb mountains again, a little slower than I used to, but I can do them, is to try to get this message out to people who are trapped on the medicines, Coumadin, warfarin, all the blood thinners that are so dangerous to people who really have active, let's say, active lifestyles or active jobs.
Doctor, is there a website where our viewers can learn more about AFib and this device?
Yeah, so a great resource is the website watchman.com. It provides information about atrial fibrillation. It also provides a story of how medications and blood thinners can help and where Watchman fits into that for reducing the risk of stroke. It also provides a list of physicians and hospitals in your region who have experience doing this procedure.
Gentlemen, thank you.
You're welcome. Thank you.
Thank you.